Speaker is Dr. Hyun Kim from Hyun University. His topic is COVID-19 as a public health crisis and response strategy in Korea. Dr. Kim, please.
Okay. Hello, everybody. I'm so pleased to be here in this very important time. I'm going to talk about COVID-19 as a public health crisis. The content is shown in this slide. I'm going to talk first. I'm going to talk the global pattern and the epidemiology characteristics of COVID-19, and then I'm going to talk some figures in Korea, and then I'd like to talk about the response strategy against COVID-19 in Korea. This slide shows the global pattern based on the data of WHO situation report. As you see in this graph, in the earlier phase, most of the cases came from China, and then this red bar is cases from the European countries, and then we see lots of cases in the United States. This slide shows the trend of total confirmed cases among several countries. The x-axis is the number of days since 100 case. As you see in this graph, the epidemic curve in Korea became flattened after 20 days. After 20 days since 100 case. So we can say that we did some good job to flatten the epidemic curve. But this kind of flattening can be observed in other Asian countries, including Hong Kong, Singapore, and Japan. However, the situation in Japan appears to be changing rapidly in recent days. However, many countries from many countries from Europe continent and the United States still shows the rapidly increasing pattern of confirmed cases. This slide shows the daily new confirmed cases due to COVID-19. In Korea, in the earlier time, in one day we observed higher than 500 cases per day, but now we observing around 50 cases per day. So we can see the big difference, the number of new cases per day in Korea and in other countries. This slide shows the number of new deaths in one day. In Korea, we are observing less than 5 deaths in one day, but in other country, there are more than 2,000 cases, 2,000 deaths in one day in the United States. So let me summarize some of the epidemiological characteristics of COVID-19. This virus is a novel one, so we during past 2 or 3 months, we are getting much knowledge about this virus. It can be summarized so we come to know what kind of characteristics this virus have. This virus have very highly transmitted, even while they are asymptomatic and subclinical phase, the viral shedding is very high. So it can be transmitted in the community very widely. And for the clinical course, it is known that 80% of the confirmed cases are self-limited. It means they undergo the mild course, and the 15 or 20% of the patients are in the serious course, and then 5% is in critical condition. The fatality is reported, initially it was reported very high in China, but it is very varying country by country. But it is well known that the mortality is high among patients with underlying medical conditions such as hypertension and diabetes and other respiratory disease, and the fatality is very high among the elderly. So this slide shows the same pattern I already said in a previous slide. So some patients start with very mild symptom, and they recover without any complications. But some of them with mild symptom in the initial phase going to come to die in the final phase. And some of the patients with a severe or critical condition found to be very unfavorable clinical outcome. From now on, I'm going to talk about data in Korea. The confirmed case is over 10,000 in Korea. We have 200 mortalities as of April 8th. But most of the cases occurred in southern part of Korean Peninsula, including Daegu area. So this is the epidemic curve during past 2 months. So the first case in Korea was reported in January 20th. And then after that, after then, we just observed 30 cases for 1 month, and then the 31st case, which is related to Shincheonji cluster, occurred in 20th of February. Since then, we observed big surge of the cases during 2 or 3 weeks, especially in Daegu Gyeongbuk area. So our Korea CDC responded quickly to this surge of the cases. So they did identification and the start of testing for whole members of Shincheonji Daegu group. And then the Korean government escalated national alert level to level 4. But before the Shincheonji surge, the Korean government approved the test at local government, and then at the private company. So this slide shows us in the early phase of the Korean epidemic, most of the cases from Shincheonji sect, religious sect. So, and then most of the cases, actually the 80% of cases are from facilities such as church or hospital and the long-term care facilities. So let me skip this slide. But recently, the cases from Daegu Gyeongbuk area decreased. So we just observing around 10 cases per day, but we are observing around 50 cases in Seoul metropolitan area. So this data based on the paper published in KCDC journal. In this paper, the duration from symptom onset to diagnosis was reported 3 days. The median is the 3 days. So if we compare these days in China, initially the days between symptom to diagnosis was 12 days, but after 1 month, it became 3 days. So this is the data about the deceased patients. So we can see some numbers. And then this slide shows the age distribution of a confirmed case in Korea and the case fatality of COVID-19 compared with Italy and China. Interestingly, most of the cases in Korea is occurring among the young groups, younger than 50. But in China and Italy, most of the cases occurred among the elderly. So the overall fatality rate appears to be lower than those of Italy and China, but the case fatality among the elderly is almost the same. So this is the death rate per 1 million population. The Italy, the mortality rate in Italy is strikingly high. So major route of transmission of COVID-19 can be summarized in several routes. One is the mass gathering in church, including Shincheonji cluster. And there are more cases in healthcare setting, long-term care facility. And then we observed many cases in densely populated workplace, such as calling center and the gym. And then recently, we think there are 10% cases with no epidemiology link. So that could be potential threat in controlling the outbreak in Korea. So we think there are some undetected cases in our Korean community. From now, I'm going to talk about the response strategies very briefly. The key model in Korean response strategy against COVID-19 is a test, trace, treat, so-called 3T strategy. So it means the mass testing and the early detection of cases and isolation, and then contact tracing and treatment. So we have some experience after MERS in 2015. So we can prepare some infection control management before this epidemic. So we did many testing. We did much more testing compared with other countries. We have around more than 100 centers which can test COVID-19 virus, including public and the public center and the private company. So this slide shows the number of lab testing is increasing as the epidemic progresses. So the number is currently 400,000 testings cumulative. So and then we are doing some active tracing for close contact. So we can, for those who are close contact with the confirmed cases, we can quarantine them and monitoring them for 2 weeks. So this slide shows the definition of close contact. And then contact tracing is done by the public health center officials. This kind of tracing can be done by some IT infrastructures in Korea, such as the GPS and the DUR and the credit and debit card usage data. So this shows through the close contact, we can identify, we can check, we can already detect the potential cases among the close contact persons. So, and this slide shows the treatment protocol. We triage cases and assign beds accordingly based on their clinical severity. And then what I said until now is the containment strategy for cases. But since 1 month ago, we are transition to the mitigation strategy to minimize the health hazard. One of the big picture in this mitigation strategy is preparing clinical capacities to cope with the patient's second wave, which may come in near future. So we need to prepare ICU bed, clinical manpower, and the rapid triage system. And then we are now trying to prepare public health preparedness clinics. And then we are doing society-wide social distancing guide. It's a campaign. It's ongoing. So in the social distancing in Korea is not a draconian lockdown. We are doing some soft physical distancing, especially in metropolitan area. So without any containment and mitigation efforts, the curve will be like this, but we can pretend by applying the aggressive containment approach and mitigation approach. But if we loosen our approach, we may encounter the second wave like this. So from now on, we need to prepare the long-time war. So we need to develop our capability across the scenario and the better preparation for broader spectrum of potential risk. And then we need to develop a cooperative governance between major agents for rapid response to public health crisis. So that's all. It's all my talk.